Meanwhile, Zimbabwe has received its first 200,000 doses of Sinopharm vaccine from China. Vice President and Health Minister Constantino Chiwenga was at the Robert Mugabe International Airport in the capital, Harare, to receive the shipment. Zimbabwe has ordered a further 600,000 doses from Sinopharm. For more on this, I'm joined now by Zimbabwean-based journalist Zenzele Ndebele. Zenzele, good evening, and thank you for joining us tonight on the Newsfeed Late Night. First and foremost, let's talk about the fact that the country has now extended its lockdown for another 2 weeks. Why?
Basically, Zimbabwe has extended its lockdown to about 2 weeks, mainly because the cases keep on increasing. They're trying to control the cases. It's actually been serious cases from January. We saw the top deaths going up to about 60 people a day. We've gone down to about 10 now, but with no plan in place or the vaccination right now, and schools still not open, I'm sure there's fear that if anything is just people are led to be free, the cases might go up, because the only vaccination that we have to the problem right now is the lockdown. So they're trying to make sure that they reduce the cases to almost zero if they can. Then they can open up businesses. But we've seen a slight improvement in terms of the business, our working hours. Shops are now allowed to close at 5 p.m. from 3 p.m. And the curfew has been moved from 6 p.m. to 8 p.m.
What is the level of compliance in Zimbabwe right now to the curfew, to those protocols that have been put in place, and of course wearing of masks and their sanitization?
Compliance has been a big issue because many Zimbabweans want to just go into town, others survive by selling, and they find that the lockdown is difficult to maintain. But also there's been fatigue. People have been in lockdown since March last year. So we've seen a lot of people, I think according to the police, over 10,000 people countrywide have been arrested since January for failing to comply to lockdown regulations. And the police actually increased as well. The government increased the fines for the lockdown. These days, if you are found not wearing a mask or going against any lockdown regulations, the maximum fine is about $50, which is a lot of money for ordinary Zimbabweans.
Yeah. Provincial travel in this extension of the lockdown is also prohibited. What does it actually mean for Zimbabweans to be unable to travel to other provinces in terms of work, but in terms of resources, food, and so on and so forth?
I think like many African cities, we are mostly based in towns, but have families in rural areas. So failing to travel to the intercity travel affects people who are working in other cities. We have families in other cities, but also those who are looking for looking after parents in the rural areas. But also we have people who have farming activities in other provinces. So it has been quite complicated to move from one place to the other, looking for food, going to see family if you are working away from your family, and also when the family is sick or there are bereavements. It's been quite complicated, but I would say maybe a necessary evil, because the second wave was really vicious. We saw a lot of people, very healthy people, dying as young as 30, 35, 37. Yet at the beginning of the first phase, people were saying, no, it's only those who are old, who have other conditions that die. So it's been hectic for many Zimbabweans, especially those who have families in other provinces and in other cities.
Yeah. I'd like to get your view and maybe what is being reported now, Zenzele, when businesses hear that government is saying, well, for you to get the license to operate during these times, you must commit to testing all your employees. How are businesses receiving that?
It's quite hectic. Many businesses cannot afford. We are talking about businesses who have not been operating properly for the whole year. And for this testing, you're talking about a US $60 each person. So if you have a company that is 100 people and you are testing at $60 per person, how many people can afford that? How many companies can afford that when they've not been trading? But also, testing would help that particular week. What if, the next week there is another case from somewhere? So it's just a measure that is put in place, but we've seen it that last year, around August, many companies opened and they were told, you test your stuff, you go back to work. By November, we're having massive cases in workplaces. So the testing is temporary. but it's not a permanent solution.
And so what are the businesses opting to do? I mean, they continue to operate without the testing. And is there any enforcement of that particular rule?
These regulations started today. So we are yet to see as the days go by how it will happen. But following what happened last year, many businesses just opened. No testing was done. It was up to individuals to test themselves, or if you have symptoms, you don't go at work. Because the problem is, you find that the moment everyone then opens, you then have bars also opening. You then have people starting to have gatherings, and this is where you see the cases of COVID going up. So it's quite a tricky situation because the businesses also want to survive. Most of them have closed. People have not been out of jobs, so they are willingly wanting to go to work. If you are told to come to work, you really want to go to work because you've been staying at home for a long time without getting an income.
Right. Let's talk then about the vaccines that have been received now, 200,000. Were these procured? Is this a goodwill gesture from China? How do they come about to be in the hands of Zimbabwean government now?
The first 200,000 vaccines that we got was a donation from China. The first country, Zimbabwe is the first country amongst the 58 countries in Africa to receive donations from China. Zimbabwe then procured a further 600,000 vaccines, which is expected to arrive in Zimbabwe next week or in the next few days. And they've said that in total, they are going to get about 1.8 million doses of vaccine from China. So there has been an argument among Zimbabweans whether Zimbabwe should have gone for China or AstraZeneca or Pfizer. But the interesting thing about this vaccination in the West versus China, it's like the new scramble for Africa. Where do you get your vaccination? So Zimbabwe got a donation from China, which was, I guess, a good marketing strategy, because then Zimbabwe decided to buy more vaccines from China.
Now, with a population of just below 15 million, 1.8 million surely falls below the required, I suppose, herd immunity of just over 64%. What is the government saying about acquiring the rest?
I guess the strategy is you start with the health workers, then you go to vulnerable groups, and probably Zimbabwe is also part of the countries who are trying to acquire vaccines as a group. Also sanctions through the World Health Organization. So probably the assumption is with time, they're going to get a few other donations from maybe the African Union, the World Health Organization, and eventually get to the 64% herd immunity.
Yeah. Is there widespread acceptance of vaccines in Zimbabwe? Are people trusting, or is there a degree of vaccine hesitancy that exists?
I've been talking to a few doctors who were really skeptical about the Chinese vaccine. One of the doctors said to me, in China, they only vaccinated 1 million people and then stopped, saying that the cases were going down. So in a country of 1 billion, why would they only vaccinate 1 million people? Another doctor told me that the Chinese vaccination was actually very expensive compared to others, because it's works about maybe $20 or so. There was also, the discussions around how effective it is. What is the information that is available in terms of efficiency? Yes, we've heard about that. We've heard that is about 79% efficient, but there are also people who are saying that the vaccination does not work or doesn't work properly within the people who actually have diabetes, who have HIV, and these are the age groups, or these are the populations that are supposed to be targeted by the vaccine. So the efficiency of it and the politics around the vaccination, there's been a lot of talk, because generally Zimbabweans don't, I guess with some people in Africa, don't trust products from China.
Yeah. Talking about the politics of it all, the degree of concern around vaccine corruption, it's a big point of discussion here in South Africa, and people who stand to benefit directly from the procurement of these vaccines, others suspecting that it could be government officials who are involved. What is the level and the degree of concern around corruption in the procurement of these vaccines?
I think we've seen the COVID corruption. I mean, a lot of companies, some linked to the family, the government officials, getting tenders to supply this and that. So, the COVID pandemic has brought another corruption pandemic where the issue of tenders is coming up. So there's not been any transparency in terms of what decision or what actually, what are the factors that led government to choose China compared to other manufacturers of drugs? Was it because of the 200,000 donation? Was it because someone was promised something? If we're talking about vaccinating the whole population, there's a lot of money involved. So is there anyone who got a kickback from this process? Obviously, there is bound to be corruption. There's bound to be government officials who are going to benefit from this. And unfortunately, when it comes to our countries, Zimbabwe, Africa, and others, corruption has always been the major driver of decision-making by government rather than the pros and cons of a vaccination.
Zenzele Ndebele, I appreciate your time and thank you very much for joining us tonight. That's Zimbabwean-based journalist Zenzele Ndebele. They're giving us a lowdown, a breakdown of the vaccine program in Zimbabwe and what has been done so far up until this point and the details around the extended lockdown. Well, up next, we keep our eye firmly on Africa. Nigerian economist and former finance minister Dr. Ngozi Okonjo-Iweala makes history by being the first woman and first African to serve as Director General of the World Trade Organization. We'll speak to Nigerian-based journalist and political analyst Deji Badmus to get a little bit more on that story. Stay with us.